You can't get out of your house. I don't know what the reason is. Maybe there's a snowstorm. Maybe you're just too sick. Let's talk things from heartburn to headaches, sinus infections to sunburns, bloating bellies to blisters. Do you have in your home preps what you would need to take care of you and your family? You've got your water, you've got your food, you've got your flashlights, and you even have your Coleman stove. You're ready. But are you? Or heartburn medication. What about your allergy pills? What about something to wash out your eyes? Should you get something in your eye, or you have an earache or a toothache? Can you deal with that at home? Or do you have to run to a store? The next unit we're going to talk about is health and hygiene from head to toe. So today we're going to start with health. We're going to talk about things that you should have in your health stores for everything from head to toe. You got this. I want you to think about this. What are some of the common ailments that your family deals with on a regular basis? Do you have gingers that forget to put on their sunscreen and are often looking for after sun care? Do you have migraine sufferers, people that have food intolerances and are always struggling with their stomach issues? What are your family dealing with on a day-to-day? Let's start there first. I'm not here to encourage you to go out and buy a bunch of random items that you don't think you're ever going to use. But I am going to encourage you to think ahead so that you're better prepared to deal with things that might happen in your family. Some of the things that I have in my preps are things I never want to use, but I also would never want to be without in case of emergency. So for those of you who don't know, my name is Tracy and I'm from Alberta and I'm the part-time prepper. And my goal is to take you through 12 weeks of prepping kickstart. Maybe it's a re-kickstart. Maybe it's you're just starting out. It really doesn't matter. If you have all the things, then you can use this as a checklist and you'll know that you are ready for almost anything that comes. And if you haven't got started yet, then maybe you can use this as incentive to do a little bit every week to be a little more prepared for your family and yourself should the unexpected arise. And I think if we've realized anything over the last few years, the unexpected should always be expected. We don't know if there's going to be crazy weather that keeps us in our house. We don't know if there's going to be extreme circumstances like a pandemic. We don't know if the jobs that are secure today will be gone tomorrow. So the more we can be prepared for, the better off we're going to be. And it really becomes a mindset. You start seeing things on sale and thinking, I use those anyways. If I buy them now at 25 or 30 or 50% off, then I won't have to spend the extra money when we run out. We never buy anything at full price. We watch for sales, and that's how we are able to build our preps up. I encourage you to do the same. A lot of the things I'm going to talk about today are not life-threatening, or at least we don't think they're life-threatening. Things as simple as a sliver that's not removed, or a blister that doesn't heal, or an infection that isn't looked after can become very serious conditions quickly. So I'm never encouraging anybody not to seek out a doctor if things look like they are getting worse. But if you can jump on them very quickly, sometimes you can take care of them yourself at home. And who wants to wait 12 hours in an emergency room? I know for us and for a lot of people that are watching, the waits in hospitals is getting longer and longer and longer. The amount of time it takes to get a doctor's appointment or even a dentist appointment, it's not like it used to be. We used to be able to call and get in later that day. That doesn't happen anymore. So if we can jump on things quick enough, then we can either lessen the situation or we can control our symptoms until we can get in. Now, I'm not going to pretend to be a headache sufferer, and I'm really fortunate that I've never had a migraine. I may have faked a headache a time or two, but that's a whole other video. If you deal with headaches, you know what helps your headaches. It might be something pharmaceutical. It might be oils. It might be a cold compress. Whatever it is, make sure that you have that stuff and you have it that it's easy to find, even if the lights are out. If you know what you need, you know how badly you need it. So I'm going to encourage you to make sure that that is easily accessible in your health stores. I'll say this a couple times through this video, but I am not giving any medical advice. If you happen to disagree, I respect that. If you happen to have an alternative piece of advice, whether it's something homeopathic or an herbal remedy, something that would help any of the ailments that I'm talking about, or maybe I forgot some of them, please let me know that too, because I'm always looking to broaden my knowledge on things non-pharmaceutical. I'm not anti-pharmaceutical, but I like to be able to reach for the things that do not rely on me going out and purchasing stuff at the store. One piece of equipment I'm going to suggest that you get is the neti pot. It comes with the sinus rinse packs. You can always get more of those packs, but this will last you inevitably as long as you clean it and take care of it. It's great to have this under your sink. If you have to use it once or twice, it will have paid for itself in the benefits. Next, we're going to move to the nasal strips and the vapor inhaler. Both of those are to help you sleep at night, to open up your airways. If you're not breathing, you're not sleeping. So we want to make sure that you're getting a good sleep. So if you are all blocked up, these two things might be very beneficial for you. Keep those in our store as well. Allergies are nothing to take lightly. So if you have somebody in your family who suffers from allergies, whether it is food allergies, animal allergies, environmental allergies, you're going to want to make sure you have whatever it is that you take. So if it's something like this or like this, have extra. Shop for them on sale, because we all know those have really gone up in price. The spray, so if it's a skin issue, if you've come in contact with a plant or maybe a bug bite and it's driving you crazy with the itch, we got the spray. And again, I'm going to put in a plug for local raw unpasteurized honey. If you have environmental allergies, taking this every single day has been known to help. Again, nothing you hear is medical advice. I do not have a doctor's degree. I don't have any medical education. I tried this and it works. So I'm going to offer some at-home remedies and some non-pharmaceutical remedies that you can do your research. You can try them. And if they work, let me know. I'm always looking for more non-pharmaceutical ways to help reduce symptoms. So if you have any of those and you hear me talk about ears, eyes, muscle, anything like that, throw them in the comments. I'll be sure to look at them, do some research, maybe try them out myself, because I would like to have more and more non-pharmaceutical things in my health preps. I did a video earlier on a medical kit that I was able to purchase. So this is the allergy pack. It comes with the EpiPen and some more pharmaceutical pills, creams, inhalers, stuff like that. So we have what we need if there's an allergy caused by pollen. We also have what we would need if somebody were to eat shellfish in our house. So we're trying to be well-rounded. We're trying to think of all the possible things that could happen and what we could do to prevent having to go to a hospital, whether it's in the middle of the night, whether it's because there's a 12-hour wait. Obviously, it goes without saying, if we are in a situation that is threatening our lives, we're going as long as we can. And hopefully we never have to deal with we cannot get to a hospital. There are no hospitals open. But sometimes it's just a matter of, I'm not going to go to the hospital because my sinuses are blocked. So I want to make sure that I have that stuff on hand. So while we're at our head, let's talk about eyes, ears, and the ability to get a good night's sleep. The things that we carry for eyes are, we carry drops for dry eye, medicated drops for things like conjunctivitis, and an eye wash glass So it's simply just a glass that is shaped like an eye. You fill it up with water. This is water that I pressure can, so I keep jars, smaller type jars, in our medical supplies so that if we needed it, whether to clean a wound or to clean out our eye. Oh, that's not right. So fill it with water up against your eye. And you can rinse your eye out if you get something in your eye, just with the clean water. So that's what we have for eyes. Next, we're going to move to ears. I also keep them in these small pouches just so that they're organized by likeness. So eyes, ears, teeth, muscle. But you'll see that as we get to them. For ears, we have drops, medicated drops, and then Q-tips for cleaning. Again, I'm going to put a plug in. I talked about the hot water bottle, keeping warm on your ear, even if it's something like a hair dryer on low, a hot rice pack, a hot water bottle. If you had an earache, there is nothing worse than an earache, except maybe a toothache. I don't know. They're both pretty bad. Salt. These are things that will help earaches. I would never go very long with an earache before getting it checked out, but usually when we get earaches, they're a day long. And if we can jump on them quickly with something, oregano oil is a great thing to have as well. We have our oil packs. So oregano oil will help with an earache. And then the next thing we're going to talk about is healthy sleep. So obviously, we don't want to be relying on anything for any length of time to help us sleep. But on the odd time, we will use melatonin. We never use it for more than a couple days in a row. We have small bottles of sleep aids, and we have Nitol, which is a sleep aid. Not something we're going to use regularly. But if you were struggling to sleep, maybe a little anxious about something going on, and you really needed to get that good night's sleep, some sleep supplements are not a bad thing to have in your preps either. And again, while we're talking about oils, the lavender oil is good to help you relax, whether you're putting a couple drops on your pillow, whether you're putting some on your neck and on your temples, or whether you're putting it in a diffuser. Lavender is good to help you sleep. Lavender has been good to help me sleep. I do not give medical advice. So we've done our ears, we've done our eyes, we've done our sinuses, and we've done our head. Now let's talk about our mouth. We're going to do mouth and teeth. So I will tell you, we store a lot of these chapsticks. Some of them are medicated. Some of them are more sunscreen. Different ways to have chapsticks. We don't use them a lot, but we like to know that if our lips are chapped, we can just grab one of these. And I also have cold sore medication. Every few years, like clockwork, I end up with a cold sore. So I have medication. I also have a small tube. It just happens to be in my purse, and I change that out as I use it. So I need to get a new one of those. Good reminder of the chapstick medication. Now we're going to teeth. And I'm going to be completely honest. I will use the Orajel to get me through until I get to my doctor. I will also chew on fermented garlic to get me through until I get to my dentist. But these are things that I never want to use. So I have a dental kit in our preps with all the tools. I have a repair kit. We have like 2 or 3 of these repair kits for our teeth. Never want to use these. I've been warned that if you put this on your teeth, they likely will destroy your tooth removing it. So this would be a last attempt. If I can get to my dentist, I'm going to my dentist. But this might give me just a little extra relief until I can get to my dentist. As well, we keep the syringes for saltwater rinses after dental surgery or tooth removals, or anytime that we feel like that extra salt water would keep our oral health a little bit better. So initially I was going to talk about health and hygiene from head to toe. It just seemed like too big of a topic. So we are going to go into hygiene after in a separate video and go head to toe and what hygiene preps you should be storing. Never fails. Your body starts being a little run down and you're going to end up with a cold. So we always make sure we have enough cold medication. I don't want to go to the doctor just for a cold, and I definitely do not want to be sitting in a hospital room hacking while somebody is there for some medical emergency and I'm coughing. So some things that we keep on hand for our colds are things like Buckley's cough syrup and lozenges. Yes, they're both gross, but they work. We have some lung issues in our house, and often we are put on inhalers. So we have an extra inhaler. We have the electrolyte drinks with extra vitamin C. Make sure that we're staying rehydrated and our electrolyte levels are not dropping. Lozenges, again, with the zinc. We want to make sure we're getting a good sleep. So NyQuil is my favorite. The Vicks inhaler for relief of nasal congestion. And then there is different salves, ointments, creams. So this is a knockoff Vicks. The Watkins medicated ointment that smells like Vicks. The Breathe roll-on or rub-on. This one here, I'm going to let you know if you're anywhere near Alberta. This is a company called Wildflower and Tallow, and it is this one is Exhale. It's made with beef tallow. It's fantastic. I could smell that all day. So nice. And then I have friends that don't send me flowers. They send me tinctures like mullein. This one here is usnea tincture. So it gives you some antiviral and antifungal. So you're going to store what you're going to use. If you have things that you want to try, I'd be trying them out now so that you know if they work, if there's any reactions that you have to them. If they work, get some extra and store them. Elderberry syrup is a great thing to have when you're not feeling well. I store it dry so that I can just make up a quick batch if myself or somebody in the family gets sick. So it's just the elderberry is dried. You add your honey and your boiling water over top, brandy if you choose, and then you're gonna swig that until you're feeling better. And depending where you live, THC lozenges, that might be something that you want to have in your food, in your medical preps as well. Drinks like Neocitrin and Lemsip that you just add hot water to, and lots of lozenges. Maybe I need a lozenge. Lots of lozenges, because not only do you want to feel better, if you have to go around somebody, you want to avoid coughing. And the masks that we dreaded, because we had to wear them for so long, we do keep masks in our preps as well. If one of us is coughing a lot and we do have to be in public, we will wear a mask. We don't want to be coughing on people. I have one of my kids who works in the food industry, and if he has to be at work, he will mask up. So those are the things that we keep. Oh, and thermometer. We do not have a thermometer anymore. We used to have the digital, the ear, the mouth. This is what we use now. It gives a pretty accurate reading, and we'll know if somebody has a fever. But a thermometer, especially if you have kids, is pretty important to have in your health preps. All right, let's get into the fun stuff. Heartburn, upset stomach, indigestion, diarrhea, constipation. Can you look after yourself? What if you ended up getting food poisoning? What if a stomach flu went through? What if you just overindulged and your stomach needs a little attention? So these are some of the things that we stock for that. We have the bone broth and homemade bone broth. Both of those are great if you are not feeling well. Nausea, we have nausea medication or anti-nausea medication. Is it anti-nausea medication? It sure is. Anti-nausea medication, which uses ginger. We also store ginger, so dry ginger. We have ginger in the freezer. We have powdered ginger. Ginger's pretty cheap and it's easy to store. So if you get a couple chunks of ginger, get it in your freezer, get it in your dehydrator, get it in your freeze dryer, wherever you're going to get it, so that you have it if you're not feeling well and you feel nauseous. Another thing that's good for that is candy canes. Peppermint is great. So whether you're taking the beadlets, whether you're sucking on a candy cane, for us, that has helped with nausea. So Christmas comes, Christmas goes, candy canes go on sale, and I always make sure that if we've used our last year's stock up, we buy a box or two of candy canes, so that if somebody's feeling they just have an upset stomach, sucking on a candy cane is really good for that. We have the fiber, extra fiber, in case we need to move things along. We also have different constipation medications, diarrhea medication, probiotics, indigestion medication. And whether you have indigestion, you're vomiting, or you have diarrhea, the one thing that we want to make sure you don't get is dehydrated. So I buy cases of the liquid IV, although they tend to get drank like Kool-Aid around this house. I do keep some in the health prep area only, so that we always have that if somebody is sick and needs to make sure that they're not getting dehydrated. And we don't want to forget Tums. So wake up in the night and you have indigestion or heartburn. Little side story, if you are traveling, you're going to want to make sure you take at least a bottle of these if you ever get heartburn. I don't have it for years, and then I travel, and maybe it's just eating food that's differently. But when we went to Costa Rica, it cost me $16. $16 for a little bottle like this of Tums. So I will never travel without Tums again. And while I'm on the story of traveling, if you don't travel with medications, you might want to reconsider that. And I'm not talking just travel to another country or travel across the country or across the ocean. Even if you're just out for the day, we carry these in our vehicles, in our purses, in our bags, and they have a little bit of everything. So Tylenol, Advil, Aleve, cold medication, allergy medication, back pain, and low dose aspirin. And the low dose aspirin is only there for emergencies. We make sure that we have low dose aspirin everywhere, just a couple pills everywhere, whether it's for us or somebody that we stumble on that might need it. But these kits, they come in 4-packs, 8-packs, 12-packs, however many you want to get, and they come with a bunch of stickers. So some of the stickers, like Gravol with ginger or ashwagandha, Tylenol, Motrin, and if not, then they have just generic ones that say allergy, and you fill in your information in those. So they're great because I have a little bit of everything in here, and whatever ails me is not going to keep me down. Remember, prepping is not just for the zombies. Sometimes it's because you don't want to have to run out to a pharmacy. Maybe it's because you don't want to sit in a waiting room. Maybe it's because you can't get a doctor's appointment for a week or 2 weeks, or the dentist doesn't work on the weekends. We prep so that we don't suffer any longer than we have to. Next, and this becomes even more apparent as we age, our muscles and our joints, they're just not what they used to be. So whether you're getting pharmaceutical, muscle and joint ache relief, joint support, maybe you're using some creams to rub down those sore spots, the backs, the knees, the shoulders, or maybe we're all working out. That's why we're sore. But we have a roll-on or a spray, and those will help us make us feel a little bit better. There's also Epsom salts. We store that in buckets. Nothing feels better after a long day of working out there, whether you're just cutting the grass, you're weeding, or cutting firewood. Maybe you're not even doing that much, but you need to soak in a hot bath with Epsom salts. So those are what we keep for sore muscles and sore joints. Another thing that we have for aches and pains is the world's best cream. So I love this because it was created by a guy from Northern Ontario. And if you don't know, that's where we come from, Northern Ontario. So although we're in Alberta now, Northern Ontario fellow created this world's best cream. I'm going to put a link to it. They've come a long way since they first got started, but this uses the copper. So 2 things that I'm going to talk about are copper and colloidal silver. This can be taken internally. I take this internally. You can decide and research yourself if you want to use it for things like throat infections and stuff like that. Or you could add it to a cream. You could add it to an ointment. You could add it to tallow to make yourself a cream. So now we're talking about skin. Here's some things that we store to help take care of our skin. Obviously, sunscreen, whether you like the cream or the spray. After sun, assuming you didn't put enough on or you didn't put it in all the right areas. This is my favorite cream to use. I use it whenever I get dry elbows, if I get any chafing or anything like that. This is great. It's nice and thick, and it comes in a vanilla scent as well, but I like the regular. If I have cuts or burns, we have polysporin and another antibiotic ointment. So for cuts, bites that may have got infected or anything like that. And this is also from the same small business that made the Exhale tallow. This one is Heal. So it has St. John's wort, plantain, chamomile, and calendula and vanilla bean. Again, it is the beef tallow. It smells so good. Like, I have no injuries, but I'm going to put it on my elbows. Again, that is the Wildflower and Tallow Company. They're out of Alberta. They may ship all over Canada, maybe all over North America. I'm not sure. You could check their website. And then Afterbite. We do have bug spray too. I just don't have it here. But Afterbite. And if you don't have Afterbite, deodorant works the same. So Old Spice deodorant or any of those non-talky deodorants will work to stop the itching. And apparently, although I haven't tried it, Preparation H is also really good on bug bites. So some things that you might be storing for different reasons end up with bug bites that are driving you bonkers. You might want to try that. So deodorant and Preparation H. So that brings us to special needs or individualized. I went through a period when I had awful restless leg syndrome at night. So I bought these in bulk. Don't know what changed, not experiencing it now, but when you're up for days on end with restless leg, keeping you awake feels like there's something going on. I have heard since then a bar of soap in your bed. Not sure why, but that might help. I just haven't experienced it since, so I haven't been able to try it. But this is the restless leg calms agitated legs so you can sleep. We store potassium iodine tablets. If you know, you know. If that's something that you want to stock up on, start looking around for it. If you're not concerned about it, you're not concerned about it. For me, having some of these in our health preps just made me feel a little bit better. I mentioned before the low dose aspirin. They used to call it daily aspirin therapy. It is not recommended that as a norm, older adults take aspirin every single day. For a long time, it was just, as you got older, that was one thing that was suggested, but now it's just only kept on hand for emergencies in case we think somebody might be experiencing a heart attack. I do carry it with me. If one tablet in somebody's mouth helps them, buys them a little extra time until the paramedics get there, until they get a hospital, it's definitely worth keeping for me. I have this women's kit that came in the medical bag, medical kits that I did the video on earlier. That's for things like yeast infections and urinary tract infections. So that's the kind of stuff I want to keep on hand just in case. I don't want to have to rush to the doctors because I have a UTI. Doesn't happen very often. As soon as it feels like something's starting to come on, I am guzzling the cranberry juice. We have freeze-dried cranberry. We powdered those down, and I drink that, and usually that's enough to ward it off. But I like to have something on hand just in case that's not enough. And just like that, we've gone from head to toe. So now we're at our toes and our feet. These are some of the things that we stock. We stock a heel balm for cracked heels. If your heels get really deep cracks, you can use like crazy glue. That'll keep it together. As it starts healing, it'll push that glue out. But if it's not that bad, heel balm is good. Peppermint creams are good for your feet. Again, the beef tallow or bear fat, anything like that. Rub it in at night. Sleep with socks on. If you can't handle your toes being covered, cut the toes off. And then real skin and blister cushions. So if you end up taking on a new active lifestyle and you're walking a lot more, you have shoes that you haven't worn in, and you spend some extra time on your feet, and you end up with blisters, you're going to want to be able to take care of those before they get worse or infected. So blister cushions, real skin to cover them. Liquid skin is good for stuff like that, and heel balms if your feet are getting a little rough. Now, I'd be leading you astray if I told you to gather these things and not know how to use them. So we're going to talk more about first aid in another video that's coming up soon, how to pack your first aid kit and what essentials you should have in your first aid kit. And then medical books that basically outline the things that you need to look for with any of the medications you're storing. If you're getting medications from a doctor and he's prescribing them preventative, so knowing that you're going to be storing them, make sure that you have the what to look fors, what to avoid when taking them, and you know any side effects to be watching for. Print those out and have those stored with the medications that you're storing. So this week's Head to Toe Health and Hygiene is actually 3 videos long. Today's, which is on what to store to keep us healthier, Coming up soon is going to be what to store in your first aid kit, and then hygiene essentials head to toe. So make sure you're watching for those, because I don't want you to miss any of this. And if you haven't seen the previous weeks in our 12-week prepping jumpstart for beginners, I urge you to go back and watch those. And remember, this doesn't all have to happen at once. You build, you build, you build, you rotate, you make sure that you're using things, you're not letting things dry out or go rancid. The shelf life on things is a lot longer than it says, but for some of it, it's not forever. Band-Aids will dry out. The last thing you want is to find out somebody's cut themselves. You go to grab a Band-Aid and they've all dried out. So keep an eye on your preps. Do an annual, if not twice a year, look over, pull out stuff that needs to get used, and have that in your medicine cabinet in your bathroom or in your first aid kit in your vehicle that you're checking on annually. And if you haven't yet, don't forget to click that bell, because I want you to be notified so you don't miss out on any of this information. You're doing great. We're over halfway there, and you've been following along. You've been doing the things, you've been learning the things, and you've been getting the things. And your family is going to be a lot better off because of it. And I always say that purchasing food ahead of time is like buying insurance, but it's insurance we're going to use. I hope that some of these things you never have to use. I hope you never have to do your own dental work, and I hope that nobody in your family is ever having to do sutures on you. But unlike when we buy food and we call it insurance that we can eat, I really hope that these purchases aren't ones that you have to use. I hope that you never get sick, your muscles don't ache, your sinuses don't get blocked. I hope you are healthy and you live a long and happy life, but it's inevitable that things are going to go wrong. And if we can heal ourselves at home, if we can take care of those symptoms at home, you're going to be glad that you made that purchase now. And until next week, take care, be safe, plan ahead, just in case. I'm Tracy, and I'll see you next week.